Hello and welcome to Autistic Tidbits and Tangents once again. Today's episode is about supporting families through the diagnostic process. And Cara,
I am really excited to introduce my friend, Dr. Garth Smith, who is a developmental pediatrician. He's the medical director of KidsInclusive Centre for Child and Youth Development, and also an associate professor of pediatrics at Queen's University in Kingston, Ontario, Canada.
welcome to Autistic Tidbits and Tangents.
Candid conversations between autistic off-hour professionals.
Cool. Trigger warnings for this episode include diagnostic framing, functioning labels, and occasional use of person first language.
So, Garth, welcome to Autistic Tidbits and Tangents. I know that you have extensive experience working with families and helping them to better understand autism and how to support their autistic children and teens as they grow up. So I'd love to hear some ideas you have right off the bat, early days, pre-diagnosis. What are some things families can watch out for? What are some things they can come into a facility like yours, a center like yours, and share with developmental pediatricians?
So I think the approach that I take with families is not just to look at the negative things about their kids, but to look at the positives, because sometimes asking families to look at strengths of their kids can help with the diagnosis, because some of the strengths are actually, their knowledge about lots of things, their extensive knowledge of things. So I always like them to start thinking about the positive things about their kids. But autism is an interesting condition because it's both a qualitative and a quantitative disorder. Qualitative because it's how they do things that are different, and quantitative because it's excessive amount that they do certain things. So the qualitative things, they do things other kids do, they just do it differently. And they also do a lot more of it. So, they'll get involved with something, whatever activity that may be, Pokemon or something like that. And they'll have millions of Pokemon cards and know details about everyone. So I think it's the importance is watching for both of those things. Does your child sort of have a variety of interests, or does your child have fixed interests? In terms of early diagnosis, in terms of the younger child, the young infant, for example, it's much more subtle. And we don't like to make the diagnosis earlier than a year to 18 months because it's much more difficult in that situation. So what we're looking for in those kids is more sort of the early developmental milestones. So things like, kids engaging, you can sort of play games with an infant from the time they're about 4 months old. You can sort of, play with them and they'll smile back and they'll coo with you and that sort of thing. A lot of autistic children or kids who are going to be autistic don't do that very well. And some of them do, but many don't. And the parents will say, it was hard to engage with my baby. As they get older, parents will call them and look at something and they don't join. They don't have that joint attention. So or they don't reciprocate. So if they want something, instead of looking at the parent and indicating, whether by sound or by saying mama or dada, and then looking at the object they want and pointing at it, they just scream. So instead of showing that sort of joint attention, they tend to just get straight to crying, and then the parents have to guess what the child wants. So some of those are sort of early signs that we look for. The other one is is regression. So sometimes kids start to speak. They may say mama, dada, and baba for bottle, for example. But then the parents say all of a sudden at 15 months, they stop doing that. And they just go back to cooing or not speaking at all. And that can be quite concerning for parents. And that's sometimes about a third of autistic kids show that sign. They just don't communicate anymore. And it causes parents concern. And they often come in and they get lots of testing done, like hearing and those kind of things, and EEGs looking for seizure disorders, a condition called Landau-Kleffner syndrome, which is rare, but it can also coexist with autism. So they get all kind of testing done, then finally they get to us and they get evaluated in more detail. Mm-hmm. So those are some of the early developmental signs. What we're noticing now is there are also some motor developmental signs that can also occur. These kids often are quite low tone from very early on. They may be late with things like crawling, or they may never crawl, but they walk eventually. So the hypotonia or low tone is often an early sign we look for in some autistic kids now that get maybe a bit of a red flag. And that's something which is kind of new and evolving. So I guess those are the main things: the lack of engagement, the lack of nonverbal communication, and the social back and forth interactions that you normally see with other kids. Those are the early signs. When I see a child, sorry.
Let me just jump in and see if we can address an autism myth right here, right now, based on what you're saying. So these things that you're describing, would you say that those are predictive in terms of how, and I do this with quotation marks because we don't like these terms too much anymore, but are these things predictive for how high functioning or low functioning an autistic person may become?
Right. So some of them are. So for example, some of the high functioning kids,
quotation marks. I'm saying that because it's a podcast.
Yes. Basically will not show some of these signs as early, and in fact may get missed because they actually may be early talkers. They may be clumsy still with their motor skills, but their verbal skills can be quite advanced in some cases.
Hyperlexic. Yeah.
Yes, exactly. Yeah. And some of them, I've had kids that have come into my office and they're already spelling words. That's the hyperlexia part of it, and reading. Mm-hmm. I had a 2-year-old who could spell Mickey Mouse with magnetic letters, and mighty, MIGHTY. So yes, they can be extremely advanced in some cases, and those kids are often missed. So they get camouflaged by their advanced development. Mm-hmm. So not all the kids have the early features, but they tend to still have a bit of the social stuff. They may be a little bit awkward with their engagement and so on. And they tend to do a lot of talking at rather than speaking with.
Yeah.
So they talk at the parents and want to have long conversations by themselves, essentially, because the parents try to interject and they don't have a chance to do that because the kid just wants to keep telling them about their own interests. So those are some of the early things that we have to be careful about. The low functioning part is a difficult one as well, because we have some of our kids that it's very difficult to predict how they're going to function from the early stages, because it's, many of them surprise us. So I don't like to tell a parent their kid is going to be low functioning, in quotes, that early on until we see how things evolve. So yeah, if there's a lot of coexisting issues like low tone, developmental delays in other areas, that's a little bit of a higher predictor than if there's just isolated areas.
Yeah. So it's the coexistence of many more obvious symptoms that may be slightly more predictive.
Exactly.
having a child who is non-speaking does not necessarily mean that you have a child with intellectual disabilities.
Not at all. Not at all. And in fact, one of the issues with non-speaking autistic children or children with autism is that they can have a condition called apraxia of speech, where they actually don't speak, but they have great language. So they can communicate in other ways. If you give them a computer, if you give them augmentative communicative devices, they come up with phenomenal words, and yet they can't speak because they have a motor problem with their mouth. So
it breaks my heart when I hear about children like that, and they aren't given a computer until they're like 9 or 10 years old, and so they haven't had an outlet.
Absolutely.
Yeah, and whether or not the screening process for that, because very often when someone is not speaking, there can be an assumption, at least among people who don't know these things as well as specialists might. There can be that assumption that it means
your kid's not smart.
Yeah,
exactly. And that's unfortunate. I see a lot of kids like that, and the parents will say, I know he's smart, Dr. Smith, because, and they give me a whole list of things which are absolutely accurate. And that's what makes me realize that they've been missed. And you ask about things like, does your child drool excessively? Does your child have difficulty? I've had children come into my office and I say, can you wiggle your tongue from side to side? And the child tries to do it, and they end up moving their head from side to side with the tongue stuck out because they can't do it. It's a motor problem, right? And that's one of the early signs of that as well. One of the other things I just wanted to mention is with regards to comorbidities, is that comorbidities often delay diagnosis because what happens is they camouflage the presentation. So I'll give you an example. The way I try to present it to parents is like this. If you have two colors of paint, blue and yellow, and you mix them together, you don't get blue with polka dots of yellow, you get green. Right? So what happens is that if a child has autism and has something else, whether it's ADHD or anxiety or a lot of other things thrown in, because they can have lots of coexisting problems, it's sometimes difficult to differentiate. And in fact, there was a great study done a few years ago in the States where they found that, I forget the percentage, but a significant percentage of kids were diagnosed with ADHD at age 4, were subsequently found to have autism, but the autism was not seen until the ADHD was treated. So what you have done is you have treated one, you've removed one color, and the other color comes to the top, right? Floats to the top. So if you remove the blue, all of a sudden the yellow comes to the top. And so you have now uncovered that ADHD, or rather the autism, by treating the ADHD. So that's another area that's really fascinating.
That's funny. I've always said if I treated my anxiety, you would see my executive dysfunction issues like through the roof. But my anxiety propels me through life,
Absolutely.
Now, how many of these early signs, like I'm trying to think sort of from an autism lens, how many of them are like, I'm thinking about the regression that you spoke of, are sensory issues where the child is now sort of inundated by features of the environment? What are your thoughts on that?
Yeah, I mean, sensory issues is a whole new area of research. There's actually a group from Israel that published some data a few years ago, about 2 or 3 years ago, where they found that sensory issues are often under-recognized in these kids as a cause of some of the issues, of many of the issues rather. And sensory issues can affect sleep. It can affect, attention. It can affect behavior. It can affect social skills, so many different things. And one of the other thing that's important to recognize is that sensory issues and anxiety coexist. And I often give the analogy that if you have an interview tomorrow morning that's really, really urgent and important to you, and you can't sleep and you're worried about this interview, all of a sudden when you go to bed that night, you notice the clock ticking in your room. That clock's been ticking for the last 5 years, but all of a sudden with this interview, you suddenly are hearing that clock. And then suddenly your back starts to itch you. And your back has been itching all day, but you didn't notice it because it was background noise. But now because you're anxious, you become more aware of your senses. So kids with anxiety exacerbate their own sensory issues. And that's very important to recognize. So sometimes treating anxiety can reduce sensory issues to some degree. It doesn't get rid of them, but it can attenuate or diminish them.
And sometimes as well, it's the other way around, where the sensory issues are producing the anxiety. And this is actually something that I very often discuss with my colleagues, is the cumulative stress of basically being born with sensory sensitivities and social processing difficulties. And it's actually that cumulative stress that can sometimes cause the nervous system to be overloaded from such a young age. And that can cause regression too.
Exactly.
Interesting.
Absolutely. Yes, sensory issues it's a really hot topic right now in research, and it's amazing to read it because it answers a lot of questions which we previously couldn't answer very clearly.
Yeah. I like to look at it through the lens of adverse childhood experiences. Obviously, the original research in that area has nothing to do with autism. But when I did my thesis, I was like, well, if we add sensory sensitivities to that list, based on what it would be like for a young autistic brain, nervous system in the world, that cumulative stress might function as an adverse childhood experience.
Right.
And then we add the susceptibility to bullying and all of the other things. And all of a sudden, boom, you have
lots of trauma.
You have really a situation in which autistic people are very likely to score higher than most other people on that questionnaire.
Yes, exactly. The other thing I just wanted to mention about that is that in terms of, oh dear, I lost my train of thought. Anyway, I think
you're on the right show, Garth.
So anyway, what I was going to say to you is, with regards to the sensory issues and the traumatic early experiences, that's what I wanted to get at. The interesting thing is that there are studies out of Romania looking at the orphanages there, and they find that a lot of those kids, when they're adopted, depending on the time of adoption, display autistic features. And these kids are extremely neglected. And what they also found is that the amygdala, the part of the brain, the emotional center of the brain, essentially, is often larger than it should be. Yep. And they've also found the same thing in autistic kids. Autistic kids have a larger amygdala than their typical neurotypical.
Well, yeah, because it's being activated so much more often. Yeah.
Absolutely. Yeah. I guess one of the other things I just wanted to mention, just going back to the diagnostic issue, is that Cara had mentioned that I have these little quirky things that I ask parents just to help them understand some of the questions that we're asking them. Because if you look at the DSM, the DSM-5 or the ICD-10 or whichever one you use, it's sometimes can be a little confusing for parents. And I'll say to parents things like, does your child play with, or does your child play among other kids? And I get this kind of eureka moment where, he plays among. He does his own thing, but he is with the group. Yeah. Is your child a creature of habit? Yes. What do you mean by that? I always ask them to explain, and they say, he likes to follow routine every single day. He has the same breakfast every morning, and then for a month, and then next month he has something different. But that goes on for another month. And then the other one I ask is your child a stickler for rules? Do they have difficulty with other kids not accepting rules? And these are the kids who will be playing soccer at lunchtime at school and noticing the other kids are not taking penalties or offside calls, because the other kids are just doing it for fun. But they don't like it because they're not following the rules. So they're constantly whistling hey, that's a penalty. It should be a free kick or a penalty or whatever. Yeah. And the other kids are quite upset because they're just having fun, right? So they like rules to be maintained and followed. So that's another thing.
That we need that framework to be able to have fun, because if the rules aren't followed, then what's even going on in the world, right?
Exactly.
Absolutely.
Really, autistic children are meant to be pro soccer players one day.
Yes.
They're ready. They're ready.
Or referees.
Yes. Oh, referees. They'd be really good at that.
Absolutely. Yeah.
I love that you explain it in those terms, because I could totally see a family not understanding if you just said, does your child show rigidity, or, some of those terms. It might even get the defenses up, right? Whereas if you say, exactly, are they a creature of habit, or,
One of the things that parents will tell me, if I let my medical student or resident do the history, they'll say, does your child play with other kids? Yeah. And if you left it there, you'd make a mistake. Because what you need to say is, how does your child play with other kids?
Yes.
Okay. It's the qualitative aspect, right? It's not, does your child play? It's how does he or she play? Some of them will play with one other child, not 2 or 3 or 4. Because with one other child, you can control the environment much more easily. But once you get more numbers, it becomes more difficult. When they do even play with one child, they like to run the rules, make the rules, and say, this is how we want to play the game. So parents will say they go to the park to play, and the other kids are playing a game, and the child will go over and join them and say, no, that's not how you play it. This is the way you have to play it. And the other kids are quite upset. And then one other child will move away with this child and play it that way. So it's interesting, because the stickler for rules issue becomes an issue with socialization.
It's actually funny, because when I was being evaluated already in 2nd grade, but autism diagnoses back then were boys' diagnoses. And so they didn't even consider that was even an option. But there was this one point in the evaluation where they put me in a group with other kids. And I think there were 3 or 4 other kids in the room, and like 2 adults doing the evaluations. And I was not interested remotely in the other kids, like at all. I was interested in one particular toy that they had in this room that was probably way too expensive, and my mom would have never been able to afford it for me. So I was just completely hyper-focused on this one toy every single time I was there. And whenever I was talking to the pediatrician alone, they would also have toys in the room. And, they were so impressed with my ability to multitask, because I was playing with these toys and talking to the pediatrician at the same time. Meanwhile, I don't understand why she's talking at me, I'm just playing with the toys that I don't have at home. And for some reason, this pinged nothing for them at that point. And I think it just goes to show like how far autism knowledge has really come since the 90s.
Yeah.
Like it's a massive development. Because today we would look at that and go like, oh.
Yeah. Speaking of the male-female issue, that obviously is something that's changing, thankfully. But I think it's certainly, I've had to go back sometimes 10 years and reevaluate some of the girls I saw when they were 4 years old, because all the questionnaires and all the testing we did just did not pick them up at all. But once they hit the early teens, they struggled, because all of a sudden socialization became much more complex. And it wasn't quite as a matter of just speaking. It's a matter of the nonverbal stuff, which is being used, the sarcasm, and the fingers that are used in different gestures and whatnot.
And the culture shift.
Absolutely. Yeah.
The culture shift that happens in girls when they go from preteen to teen years is massive.
Yeah.
I just remember being so confused.
Yeah. it's quite fascinating to me. And it's interesting because a number of those kids have come to me now, not kids that I previously saw, but kids I never saw before, who are now 13. And they're coming in not with query autism. They're coming in with, oh, my child has some mood issues. They're starting to act up, and they're getting angry all the time. And then when you go back in time, you realize that in fact they were camouflaging their symptoms so well that now they're having more difficulty doing that because communication and socialization is so much more complex than it used to be.
I remember in high school, just like, actually my mother would comment all the time that I would come home and I would nap for hours. I was just so exhausted. And I haven't felt that exhaustion until recently when I was really burnt out. But it was the same thing I felt in the teen years. And my mother always said, like, you shouldn't be sleeping this long. But I think that was it, the demands, right?
Well, what I call that, we describe to parents that when I see a girl with a female with autism, potential autism, I say to the parents, how's your child after school? And they say, oh my God, that is the time when everything falls apart. And I say, the 4 o'clock explosion? They say, absolutely. Because what happens is they hold it together at school
all day.
So well. And then they come home and it's like the pot is just about to explode. It's been under the heat so long, and the lid pushed down so hard. They get home and it's like, don't speak to me.
Yes.
I need to go and chill in my room.
I am still like that, Garth. I still need my downtime.
That's still a point where you're coping with the situation, though, because what I see are, obviously, working as a clinical psychologist, I tend to see kids when it's gone really wrong. So I usually will see kids when they have completely stopped going to school. They've developed severe depressions, really severe anxiety. They're completely unable to leave their rooms. Sometimes I have colleagues that will actually have to go and do sessions in people's houses because the child cannot leave their own bed.
Yes, exactly.
And it takes years sometimes to actually help that child, that young teenager, to move, out of their own bedroom.
Yeah.
And it's so tragic to me that very often the signs aren't noticed and they're seen as, mood disorders or, just teen problems, or, they're just being dramatic, or.
And they've internalized it as like, they're like,
and
I'm a bad person, right?
Or lazy.
Which laziness doesn't exist, but.
Yeah.
Oh, yes.
So what advice do you give to parents who come to you and say, my child is having these explosions or withdrawing completely when they come home from school? What are the first steps to investigate?
So, well, if I already have you mean if I don't know the diagnosis yet?
Well, either if I'm guessing, since we're talking about autism,
sure.
Let's assume that we know that we're talking about autism.
All right.
And this is just a shift that's happened. The child's moved into the teen years.
Yeah. So the first thing I tell the parents is, first of all, teenagers themselves without autism like isolation. They're trying to be independent. And you add autism to that, it just takes it up a level, right? Or 2 or 3. And what happens is that they need to get a break. They need to have a time. I describe the day of an autistic child or a female, whoever it is, as like going to school, assuming they had a good night's sleep, with a full tank of gas. The gas tank up here in the brain is full. By the end of school, they're running on empty. They're running on fumes. So when they get home, they need to refill that gas tank. So giving them a break, no school homework, nothing, just give them a break to go to their room for an hour or so to chill, to refill that gas tank. Some of them have a sleep, some of them have a break, just playing video games or whatever. 1 hour, don't touch them. Mm-hmm. Then they come out and they have a big smile on their face. They're feeling much better. That's one way. The other way is preventative, and that's working with the school. And with the schools, obviously, if it's a teenager, it's a little more difficult, but you can still ask the school to give the child breaks, the teenager breaks at school. You don't call it sensory breaks, but it's really a sensory break. Mm-hmm. They need to just be allowed to leave the classroom and walk outside for a few minutes, admire the flowers if it's summertime, or if it's winter, just go take something to the principal's office, a letter or something. And they become the chief carrier of messages to the principal's office. And just a break, and just take your time to come back. You tell the child, tell the teacher to give the child, make him or her in this case, take their time to come back to the class and then sit down. And it can't be just preventative. It can't be just when necessary. It has to be prophylactic. Because if you wait till that time when it has to happen, the child is already at an end.
Yeah. I always find that one of the big areas where we can make a difference in school is actually the lunch break.
Yes. Yeah.
Because very often the sensory environment during lunch is madness.
Exactly.
And if it's possible to take that sensorily sensitive child, whether they're autistic or not, and move them into a quiet environment.
Exactly. Yeah.
That takes off a huge burden.
A lot of my patients actually have MP3 players that they go into a quiet room and just listen to music. They have their favorite music type of music or singer or whatever and performer, and they just sit down for whatever it is, 45 minutes and listen to that person. Yeah. And it's very relaxing for them.
Oh, music can be a huge help.
Yeah.
Actually, something you said earlier makes me think of something that parents will come to me with, because we're trying to advocate that parents allow their children to withdraw, but very often, especially mothers, I know it's it's a generalization to say that, but I very often hear it from mothers who are like, but it feels like my child doesn't love me. They don't want to spend time with me. They want to be alone in their room. They don't hug me anymore. What do we say to parents who, are feeling that despair? Because the despair is genuine.
Yes. If the child was a previous hugger and is no longer hugging them, I would say giving them the break is going to replenish that feeling. I think they're more likely to come back and want to hug if they have had a break and they're sort of feeling less tense, right? Less stressed. Because some of these kids will actually come home not only with anxiety or with stress, but also with headaches.
Yes.
And some of them will come home and they say, my head is about to burst. And especially the ones that are prone to migraine headaches, that can be an additional issue because migraines also increase sensory issues, right? So it's like a double whammy for these kids. Yeah. So some of these kids, we actually end up prophylactically treating them for migraines because they'll have 3 migraines a week and they come home from school sick. They're actually vomiting. And it's just awful. So it's not everyone we do that with, but some of the kids, it's so impairing for them that we end up doing that. Yeah, no, I think it's a big thing. And it's certainly something we have to have a 2-sided approach to, the preventative and then how to deal with it at home. Because if you just look at it one way, then it's going to still be there building up at school. And some of the kids have the 4:00 explosion at 1:00 at school. Right?
Yes, that's right.
May not last till 4. So,
the explosion or the shutdown, quite frankly, happens when you're out of resources. So when your capacity is spent, what are you going to do?
Yeah,
and you can only stay in robot mode for so long.
Exactly. The other point I just wanted to make there is that autism spectrum disorders are not the only things that cause 4:00 explosions. Attention problems can do that. Learning disabilities can do that. Anxiety can do that. So you add them all up because some of these kids have all three or more.
Yeah.
And when they come home, and that explosion is huge because they've struggled all day with learning because they have a learning disability. They've struggled all day with anxiety because they have a variety of anxieties, whether it's general anxiety or whatever. They've struggled with the fact that everybody in the class is so messy. So they've got a bit of OCD as well. And then they struggle with the fact that they also have this social challenge, right? So it's like it all adds up and becomes such a problem at the end of the day. So sometimes the management is not just the autism part of it, it's the coexisting problems.
Yeah. And Garth, I'm just thinking too, going back to Maya's question about when parents are having trouble sort of adjusting to sometimes what is, typical of teenagers, which is wanting to separate a bit from parents. Yeah. You have a great analogy about deep sea diving. I would love for you to share.
Okay, my deep sea diving analogy. Okay, so I don't know how you remember these things, Cara.
It's my
autism.
Yeah.
So I have this story that I tell my medical students. I say to them, early teenage years is like being a deep sea diver. A deep sea diver that has never entered the deep sea, but they want to enter the deep sea. So when they're going down, they're connected to the boat by two things: a hose, which carries oxygen, and a rope, which gives them a chance to tug at if they get into trouble. In the ocean, there are lots of dangerous things. There are barracudas, there are sharks, there are whales, there are octopus, there are all kinds of things down there. So initially, you can't give them too much rope because they aren't accustomed to dealing with those enemies, those dangerous things that are out there. But after they've had a chance to prove themselves, then you can extend that rope. The next question I often get is, so what's the oxygen? The oxygen is actually the nurturing, and that never changes. That always exists. So parents will continue to have kids even when they're 40. Like when you're 40 years old and you leave home, you still call home and ask for advice, right? That's always there. Well, in most families, not every family, but so ideally, ideally, the oxygen should always be there. You don't cut that off necessarily. But the rope you can cut after a while because you don't need it anymore, or you can extend it. So a lot of teenagers need that independence, but they have to be given a chance to prove themselves first that they can be capable of being independent. So,
and most importantly, they're not proving themselves to you, the parent. They're proving themselves to themselves.
Exactly.
Good point.
Absolutely. Yeah, absolutely. So that's just my little analogy there. I'm not sure if I got it right, Cara, but that's what
pretty good.
I think it's brilliant. I like it.
Should we do thing of the day?
You know what? Yeah, let's do that.
All right. So I was thinking about this topic and I was thinking about diagnostic tools, and we know they're not perfect. We know, they don't catch everybody, but Spectrum News looked at 3 studies in different African countries in 2017, where they're actually creating like an open source diagnostic tool, I believe. I haven't checked to see if there have been advances in the last 5 years, but okay. So the first group of researchers is out of South Africa, and they translated the ADOS, the Autism Diagnostic Observation Schedule, into Afrikaans, and they had this done for 40 people who had an autistic child, and they were mostly low-income families as well. And they discovered that 20 words on the test were not universally understood. Most of these were emotions words. And then more than a third of the parents reported that their child would be afraid to play with the toy frog in one of the tasks because reptiles are much more dangerous probably in that part of the world than in Western countries, in North America anyways. And that some activities referenced, like blowing out candles on a cake or singing happy birthday, would be completely unfamiliar. And often, because of gender rules, boys wouldn't want to play with the baby doll. Then the other group of researchers in Tanzania found that part of the ADOS, which involves a reading task, only 4 out of the 51 adults surveyed said that they actually regularly read with their children. And also they commented that, birthday celebrations are really more of like a rich person thing. Mm-hmm. And so they wouldn't have those experiences. And then the Ethiopian cohort of researchers found that, and this I don't know why, so I'm curious about this, but they found that these families were unlikely to report repetitive behaviors like hand flapping and body rocking, though they noticed social difficulties and speech problems. And this group of children were mostly non-speakers and also with intellectual disabilities, who tend to be the children most diagnosed in African countries. There's so much stigma, so you're going to miss a lot of lower support needs autistics. But also they found that lining up toys is not something they could really evaluate in Ethiopia, because you might not have a ton of toys to line up. And instead, one of the children just lined up all the family shoes.
That's right. Yeah, that's interesting. I think one of the issues with translation of anything is exactly that, culture. Culture affects translation. I work in the northern communities of Ontario, where they have the Indigenous population. And I find the same thing. Many folks up there don't look at you when you're talking to them. They get very poor eye contact. And it's not because they're all autistic. It's just because it's a cultural thing. Mm-hmm. You're taught when you're younger, don't look at people when they're talking to you. So, eye contact will be ticked off by 90% of the folks up there. So you eliminate that right away as one of the diagnostic criteria. So I think translation is difficult, and whether it's translation of the actual toys or equipment you're using, or the actual words. Because I'll give you another example. There's a picture in one of the psychological tests that you may be aware of, Maya, and it has a picture of a fire engine on it. No, an ambulance on it. Yeah. And every child answered it as though it were a fire engine, because up north, they do not have ambulances in many of the communities. It's the fire trucks that pick up people that are sick and bring them to the hospital. No ambulance. So when they saw the thing with the light on top, they said, a fire truck.
Yeah.
So I'm just giving you simple examples like that. So we have to be aware of the culture before we interpret the result, right? Yeah. And before we use certain tests, we have to be careful about interpretation.
I mean, it's a huge thing, actually. And I find it as well. I don't evaluate young children myself. I usually will evaluate teenagers or adults. And in Denmark, psychologists aren't allowed to set the diagnosis, or our municipalities don't acknowledge that psychologists can diagnose people. So they'll only accept it from psychiatrists. But we will still do the evaluation and do a report for the psychiatrist to look at. And what I find very often is that we actually need to go through the questionnaires with the person in person, because so often the questions are misunderstood.
Yeah.
And also, when you're asking someone, and I think this goes for parents as well, does your child do this? Well, yeah, but do they do it more than other kids? I don't know. I've only ever had this kid.
Yeah.
How am I supposed to know what's normal and what's,
Yeah, that's absolutely true.
And so I really think that there's been this tendency to keep people out of the knowledge of how do we diagnose. And I don't always think it's useful. Sometimes we really do need to include people, and we really do need to sit there with them and be like, no, this question is meant this way.
Yeah.
Mm-hmm. Because otherwise they might actually answer in a way that will prevent them from getting a diagnosis that they do qualify for.
Right.
Especially as autistic adults, like if you are late diagnosed or you're seeking a diagnosis, and autistic people have the tendency where we want to be accurate and precise all the time. So anything with Likert scales, I cannot do. It's always been a problem. Even like high school multiple choice, true or false, I would write my answer. Like I wouldn't just circle. I need to tell you what I know. And we're more likely to give sort of an inaccurate answer, I think, because of our tendency to overthink what is it really asking or what is it trying to collect.
Yeah, but this goes for parents too, because
and many of them are autistic.
Exactly. Autism is so hereditary. There is most likely at least one autistic parent.
Yeah.
Yeah. And the other thing is that besides just being hereditary, you actually have more neurodevelopmental problems in the family as well. So it may be ADHD or specific learning disabilities or anxiety or whatever, right? And that complicates the issue as well, because sometimes the parents, the other one that I hear a lot, which just occurred to me is, my new little son, he's just, 2 years old, and he's starting to mimic his brother's behavior.
Oh, yes.
The non-autistic child will not mimic the autistic child's behavior. That is so rare to see that. It's more likely he'll be correcting his older brother and saying, don't do it like this. This is the way you are to do it, right? So when I hear parents saying the other sibling is mimicking their older sibling who is autistic, I often take a deep breath, because I say, maybe I should keep a close eye on that sibling, And then invariably 2 years later, we get a question, the child referred to us with the question of possible autism. Yeah, it's fascinating. I think the whole issue of culture and family and all these different things. And I think culture is really something that we have to be careful about. The utilization of words. I say to every parent that comes to my office, I say, the reason I'm spending 2 hours with you at least is because my philosophy is a better description allows for a better prescription. In other words, the more I understand your child, the better I can tell you what to do about him or her. If I were to rush through and make a diagnosis and I didn't get all the details, I could give you wrong advice or the wrong diagnosis, because there are lots of lookalikes out there. Right. And sometimes a lot of people will jump to the conclusion the child has ADHD or anxiety and forget about looking at autism, because the ADHD is hitting in your face because the kid is all over the room. Right.
Yeah. Yeah.
And they don't realize the child actually does have autism because they're so fixated on this hyperactive child in their office. And some of that hyperactivity could be sensory. Right. So as you were talking about, Maya, excuse me.
Yeah, it's for me, the amount of autistic people that I see that have one or more comorbidities is quite astounding. It's I sometimes don't think that autism is the primary problem for a lot of people. I feel like, well, this is true for myself as well, but it's certainly also true for so many of the people that I speak to, is it's the anxiety, or it's the reoccurring depressions, or, it's the OCD, or even untreated ADHD, either through medication or through strategies. Like when you don't have what you need to, when you don't have what you need to deal with whatever else you have, autism becomes a huge issue.
Yeah. So, what I would add to that, Maya, I would add to that the fact that, in fact, in almost every autistic child I see, they go through phases. And at different phases of their life, different comorbidities may surface as the bigger problem. Right? So when they first hit the school system, the first thing the teachers see is the hyperactivity, right? If the child happens to have that comorbidity. So they get referred to a pediatrician or a family doctor, and they get treated for their hyperactivity. As they get on in school, people are starting to notice there are different ways of playing or not playing with other kids. And then the autism stuff comes up. As they go further on, the anxiety may show itself. And especially in preteens, we see a surge of anxiety coming up as they hit about between 9 and 12. The anxiety tends to start climbing. And then after that, and at any stage in there, the learning disability comorbidity may be there as well. The other thing we have not talked about is the physical comorbidities, like developmental coordination disorder and things like that. Many of these kids are clumsy, right? So we like to say, well, if your child has difficulty making friends, let him get into sports. Well, hockey, basketball, or soccer, forget it. Football, no, can't do that because he is not very coordinated. He might be able to swim or do taekwondo or judo, but forget about those multitasking, multiplayer type and activities. They can't do it. So that is another source of stress for families. Because they're trying to get their child to socialize and they're trying to get their child to be engaged with other activities to get them thinking less about their problems, but that's difficult.
I always recommend tabletop role-playing games.
Yeah.
Yes.
And I do that because it's usually a fairly small group, or at least you can usually find groups that set up smaller tabletop role-playing groups. And in most areas, because role-playing has become such a popular interest over the last, 10 years, something, usually if you have, a teenage child, you'll be able to find somewhere where they have, people who know something about autism and who run, for example, Dungeons and Dragons groups or whatever. And so you have an adult game master. In D&D, it's called a dungeon master. Sounds terrible. It's fine. But you have a game master who's an adult and who can support
and structure it a little.
Yeah, exactly. And you also have an environment where not only can you socialize, but you can also take breaks and you can ask questions and you can be open and honest about your difficulties without kind of being judged, because a lot of the kids that do role-playing games are,
usually
nerds.
judged. Yeah.
Exactly.
And they're usually the outsiders. They usually have their own difficulties. They might not be the same difficulties, but there's, I don't know. I just see so many kids that find acceptance and, joy and friendships in that environment.
And fun fact, I play Dungeons and Dragons with Garth's son.
Really?
Yeah. And
there you go.
But the other thing that's great about role-playing games is it does allow you to sort of practice interactions and practice different decision-making things that you might not do in real life or be confident to do in real life. You make decisions on the fly. You have to discuss with people. You can really slow it down and break things down. While you make decisions. So I think it has a lot of great, other life skills that you learn through playing those games.
It does. One of the things that I actually used it for was to try on different personalities, not because I wanted to explore different identities for myself, but because it helped me to figure out, why do people do what they do?
Yes.
And if you're using other characters or fiction even to explore, those social contexts and different motivations that people can have, how do other people maybe experience emotions or relationships, whatever they're doing. Why are these other things so important to other people? Right.
Exactly.
And practicing that in a safe setting gives you the foundation to go out and do it in real life.
Yeah. Yeah.
Not that you'll always succeed, but I don't think anybody does.
True.
I just have to tell you one quick story. One of my, several of my patients will tell me when I ask them how many friends they have, they'll say, I have about 5 or 6. And I say, you have 5 or 6? That's awesome. So what do you do with them? I play video games. Where do you play it? Oh, online. Have you met these friends? Never.
Mm.
Okay, do you know what their names are? No. I just play games with them.
Yeah.
But they literally have no friends outside of that environment. So their idea of friendship, and it's one of the ways they actually deal with their own lack of friends is at doing that. Which I think it has a positive side to it, because they are so proud that they have these 6 friends. Obviously, there are some dangers sometimes with having friends online.
Parents would definitely have to monitor. That's for sure.
Exactly. But it certainly has some positive sides to it as well, because some of these kids would be so depressed if they had if they didn't have those.
If they were cut off from that,
yes,
that can cause a huge crash.
I just read a study. Don't have all the details. This is off the top of my head, but it basically looked at like typed communication and how neurotypical folks would rate autistic people as very high in likability from the typed communication, but then not in face-to-face communication. So a lot of times access to communities online through technology, removing some of those like face-to-face barriers that might exist, allows autistic people to be more successful. But the thing is, we don't want them to just be successful online. We also want them to be able to feel good in face-to-face communities too. Okay,
but here's what I find though. Hi, World of Warcraft since launch. I'm in a guild that has members all over Europe. Well, not all over. It's pretty much centered around Scandinavia, UK, Ireland, and Holland. That's the primary. And so I'm a fairly recent member of this guild. I've only been there for 4 or 5 years, something like that. But they've existed for 12 or 13 years. And I went to, and I tell this story sometimes when I talk about computer games and, online friends and such, because I think it's so important. Obviously, most of these people are grown adults. Some of them are, grandmothers and such. But I went to a real life meetup. So obviously most of the communication is just through World of Warcraft and Discord and all of that. But there was this meetup. 15 people came to one house in the UK for a week. Not everyone was there all the time, but 15 people throughout that week. 4 people there were autistic.
I'm surprised it wasn't more, actually, but yeah.
I haven't mentioned the other diagnoses that were presented.
Lots of neurodiversity.
Lots of neurodiversity for autistic people. I've never felt so accepted and so free to be authentically autistic. At one point, one of the other autistics and myself, we were in the kitchen, which is kind of in the central area of the house. We were in the kitchen and we were happy stimming about something. Like we were both flapping our hands, rocking from side to side, and we were just having a blast. And out of the corner of my eye, I saw a couple of the others kind of pass through the kitchen and just stop and just look, just give us a quick look and then keep walking. And I realized after a couple of them had done it, that for the first time, I was in a house where I didn't expect people to judge me based on the stimming. Yeah. They were just checking to see, all good? Yeah, happy stimming. Great, cool, move on. Or even, being happy for us and kind of wanting to join in, but being like, I'm not autistic. I shouldn't do that, but it looks so much fun. And that level of acceptance, I think sometimes you find it through people that you meet through unconventional paths.
Yeah, because it's a small pool of kids at school. You're not necessarily going to find your neurodivergent kindred spirits,
No, exactly.
I'll tell you something. One of the things that I find fascinating is, when kids come into my office, I think I mentioned this briefly before, but I always say to the parents or to the child, I say, tell me some things you're good at or tell me some good things about you.
Yeah.
And it's amazing to watch the parents' facial reaction. They're so shocked because what they came in with a list of problems this high, and they thought they were going to be coming and talking to me about the problems. And I said, no, we're going to get to that. But what I want you to, first of all, tell me is some good things about your kid.
Yeah.
Why did I do that? Well, I did that because after doing this for so many years, I discovered about 10 years ago, I have to stop doing what I used to do because the kids would look like they would like to be anywhere but there.
Yeah.
Yeah.
Because the parents would start listing all the problems their kid has, all the ostracizing and the bullying and the negative experiences. And they wish the child, you could see he's quivering in his chair and wants to get onto my desk and hide if possible.
Mm-hmm.
And I would just say, when I said the positive things, the kid would start to smile. Mm-hmm. And he'd say, yeah, Dr. Smith, and I'm also good at this, and I'm also good at that. And my favorite video game is, I said, awesome, that's great. Good to hear these good things about you. And for the rest of the encounter, the child would be volunteering things. Even though we got into some of the problems, the child would volunteer information to me.
Yeah.
And that just changed the environment totally. But the interesting thing was, sometimes in listening to that list of positivities, you actually got a clue that the child was autistic.
Yeah, I'm sure.
Because the parents would say, oh, he's super smart.
Yeah.
Oh, okay. So what makes you say that?
He knows all the capitals of every
country. He knows all the countries of the world and their capitals in alphabetical order. Okay. And he can say them backwards too.
Wow.
Awesome. That's good. What else? What else does he know? He knows every planet in the universe, and he can tell you the distance from Earth.
Wow.
Okay. Well, that's really awesome. And meanwhile, my brain is saying, okay, this kid is either really gifted or he's on the autism spectrum.
Or both. Yeah.
Yeah.
He's 9 years old and he can name every European war since the 1400s.
Right.
It's funny how many kids like the wars. I've had so many kids know about World War II in detail and every bit of it. And it's fascinating.
Yeah. I think history is just fascinating because it's dates and numbers and events and facts, and you can put them into system and you can figure out, oh, this happened there, but then this happened there because of that. And then
and yet so many of my students hate history. I have a few who love, but I've had so many who hate it, and I love history. So, but I think for them, maybe it's taught without a context of why it's important. So I always say, like, really, we're learning about human behavior through history. Like we're learning about how people have responded to things in the past. And we have to focus on the emotional impact of events to really understand why we still talk about these events. But I digress. That's a tangent.
But it's an important one because many autistic people are very interested in systems and numbers and facts and keeping things in their boxes. But then there are the other ones of us for whom people are a special interest. And I had that same experience. I was not interested in history until I realized, and unfortunately, this wasn't until like high school age, until I realized history is about people having made decisions and the consequences those decisions had.
Yeah, exactly. Yeah.
And that's what made it interesting for me. So I think there's that other segment of autistic people who we still have special interests. They are still special interests, but they're different from what is expected based on the classic profile. Which I think brings me to probably like an ending question, if that's okay. What would you say is kind of a defining characteristic that is a positive thing about autistic people?
Okay, a defining characteristic.
Obviously, nothing is going to apply to everyone.
No. I just think it's just their perspective on things. I think they have a different perspective, and it's always fascinating to me to ask them to expand on it, because I learn things from many of my autistic kids. I'll tell them this. I say, you have taught me so much in the 1 hour I've met with you at my follow-up appointment that I would never have learned otherwise. So I think it's just the unique perspective that they tend to have on life in general and on things in our world in general. I just think it's so amazing. I'll tell you, I know you're ending on this, but I'll just tell you one quick story that I think is really a fascinating one. This little boy came in to see me when he was 4 years old, and he came into my office with 2 extension cords in his hand. And I said to his mom, extension cords, that's interesting. What's that for? He says, Dr. Smith, he has always loved extension cords. For his first birthday, second birthday, he wanted an extension cord. They got it for him. I don't know if you probably wouldn't know this, Maya, but there's a place in Canada called Canadian Tire. And they sell electrical stuff and all that stuff. That's his favorite store of all times. He'd go there for every birthday. He would go there to Canadian Tire.
Wow.
When he was 8 years old, he had about 50 extension cords in his house. And then he said to his mom, I've had enough of extension cords. Now I want to have a remote control car. When he was 16 years old, his father was mowing the lawn with one of these driven lawnmowers that he had to drive. And the kid saw his father mowing and was watching him in fascination. All of a sudden, the motor stopped and he couldn't drive it anymore. So the father got angry, went off to go and pick up the repair guy to fix his lawnmower. When he came back, his son had pulled the entire engine apart and had it on the lawn. He was livid. So anyway, he got the guy back in the car and he drove him back swearing the whole way back to the garage. When he came back, his son was riding the lawnmower on the lawn.
Does not surprise me at all.
He fixed the lawnmower. This same kid is now 24 years old and runs a small engine store in Kingston, Ontario, where I live. In fact, 2 years ago, he came to my house and fixed my lawnmower for me.
That is so awesome.
It started as extension cords.
Yeah.
Okay. Wires. Yeah. And went into small engines, remote cars, and then eventually into fixing small engine vehicles. So that's the fascinating thing. They have a perspective. They have it's just, I say to parents, don't discourage some of their fixations, because some of these fixations translate in later life into a job. Being interested in animals sometimes results in them getting a degree in oceanography. I've been doing this long enough. This is my 35th year now. And I have seen kids grow up and graduate from university and come back in my office and tell me what they're doing. And it's just been a fascinating experience. So I love their perspective on life. I love how they interpret things. I think that's probably one of the most fascinating things for me.
And there tends to be a love of learning, which is basically what you described. They're very independent learners, driven to learn about their areas of passion.
And sometimes it's hard to see the end point at the beginning.
Yeah.
But you have to have a little patience.
Well, as Paula Kluth says, she says, you don't have to understand the passion in order to honor it.
That's right. Exactly.
Mm-hmm.
Yeah.
Yeah. And also, there are a lot of autistic fixations, special interests that don't translate into jobs, but they still translate into joy and, quality of life.
Mm-hmm.
And that's worth something.
Absolutely.
Even if it doesn't make money.
Yeah.
You know what? I actually, can I ask one more last question?
Please. I love your questions.
So, because both of us, we deal so much with parents, and I mean, Cara does too, obviously through her job. And very often when I do speaking engagements, I'm asked, do you have a piece of advice for me yada, yada, yada. And I'm always pulling advice, out of a backpack that I didn't know I was carrying. But I find that for me, they always intersect somehow. So if you were to sum up your primary advice to parents, and of course, by proxy, also to young people who may or may not be listening to this podcast, we hope, what would it be?
Okay, I think for parents, I think what I said a few minutes ago about seeing the positives in your child, I think we all know, whether it's autism or other coexisting problems, we tend to look for the negatives. And one of the difficulties with questionnaires is that questionnaires force us to look for negatives. Mm-hmm. If you look at the ADHD questionnaires, they all look for the kid is not sitting still. He's disruptive in the class. It's all forcing us to look at negatives. We have to force ourselves to look for positives. And I think I encourage every parent to stop just looking at the negatives and look at the positives. Russell Barkley, a very famous psychologist from the States, he says, if you can find 5 times to give your child positive attention, for every 1 time you have to give them negative attention, you're probably going to be successful. Mm-hmm. And I think too often we ignore the positives and focus on the negatives, and that creates more challenges for your child. I tell kids, I say, what often drives the kids that I look after the most in the negative direction is the negative feedback from their peers. Mm-hmm. And that's hard because there are some mean children out there that just don't realize the harm they're doing to their peers when they do things like that. And one of the things I try to tell the kids, I said, where there's no audience, there's no show. So I say to them, if you ignore the person that's bullying you and just walk off and smile, it makes them so upset they'll leave you alone. It may not happen the first time or the second time or the third time, but eventually it may happen. And that's one thing I tell a lot of my patients, and some of them have come back and said it worked. It took a week, but it worked. And it just, the other kids expect you to react. Yep. But if you don't react, it annoys them because what they want is a show. And if you don't give them, if you don't give them an audience, their show is worthless, right? What they're trying to create is worthless. So I think it's a matter of not giving them an audience because you're not paying attention to what they're doing, and eventually the show stops. So I think that's one of the bits of advice. I have lots of other ones that I use.
Yes, you do.
But that one, I don't know if you can remember any other ones, Cara, but that's one of the ones that I have found recently is the most challenging for the kids, is that they get so much negative attention. And I think I try to get them to be more positive. And I also try to work on the teachers at school, not teachers like yourself, Cara, who are experts, but teachers that are not experts. Mm-hmm. And I say to them, you know what, if your child in your classroom is very artistic or is very good at something, make a show of it. Give them a chance to show off, make a show and tell thing in the classroom. It's so empowering for these kids to know that, wow. And one of my kids was into the mummies in Egypt. Ooh. He knew all about mummies in Egypt, and he stood up in front of the class and gave a talk on mummies in Egypt, and he got a standing ovation from his classroom. And that was the first time ever he had that. And I think if you can encourage the teachers to encourage the kids to show off their skills, if they have skills to show off, that's another very positive thing.
Love it.
It reminds me of a campaign many, many years ago on YouTube. I can't believe I just said that sentence. There was a campaign called "It Gets Better," and it was aimed at
LGBTQ plus,
and people who were well, not straight.
Mhm.
So all kinds of queer and trans and everything kids. And I just think for so many autistic children, they actually need that campaign.
Yeah, exactly.
But for neurodiversity, like just the knowledge that
it gets better. You'll find your people.
You'll find your people.
Small pool in elementary, small pool in high school, but beyond that, you'll find your people.
Yeah.
One of my patients created the Geek Club at his school.
I love it.
He started with 2 kids who were also Aspies, as he called them. And then he went to the principal and said, "Can we get a club?" And the principal said, "Sure, I'll check with Dr. Smith first, but sure, it sounds good to me." By the end of the year, he had 12 people join his Geek Club, all of whom had high-functioning autism.
Wow, that's incredible.
That is so cool.
Yeah.
Well, thank you so much, Garth. It's been a pleasure talking with you as always.
Yes, it's a pleasure, Cara. Good to see you again. And,
you too.
And Maya, wonderful to meet you. You sound like a wonderful person.
She is.
Oh, thank you. Well, it's been such a pleasure to meet you as well, and to hear your perspective on things. It's
all right. Well, have a good rest of your year.
You too.
Thank you.
Bye-bye.
Bye, Garth. Autistic Tidbits and Tangents.